Hey everybody, welcome back to the Outcomes Rocket, another episode from the Becker's Health IT Conference. Today, I have the privilege of hosting Rick Bemis. He is the Chief Data Officer at the Ksquare Group. Rick, thanks for joining me today.
Well, you're welcome. Nice to be here.
Absolutely. So look, we're covering a lot of interesting topics here. And to begin with, I just wanted to ask you about the Ksquare Group. What is it that you guys do, and how do you add value to the healthcare system?
We're a consulting firm, a managed services group too, out of Dallas. We have nearshore developers in Mexico City and Merida. And so we provide value at nearshore and also provide accelerators for healthcare and mainly provider. And also we have a large Salesforce practice too.
Interesting. If you had to point to one thing out of the services that you provide, what would you say is your strength?
Well, right now it's our provider accelerator, which is an generative AI-based accelerator that helps people with their provider directory and provider network. So a lot of times people have a lot of mundane tasks that they have to do. Well, our accelerator helps optimize those mundane tasks and also reduce the risk and improves data quality on the provider directory for most healthcare systems and payers.
That's fascinating. Here at Vectors, we've been having a lot of different conversations. And if you had to point to one insight that stands out as interesting to you, say it is.
Yeah, I think what's really interesting to me is the conference has a lot of revenue-based type of solutions that they're doing. And I think sometimes we can help them with respect to operational optimization and making sure that we can help hospitals, payers, and medical groups have a better operational cost reductions and better quality of information going out to their provider directories and their provider associations. Our tool also actually allows providers to see within their area what kind of doctors are around them, what kind of providers are around them. And it's just not just physicians. We can go for physician systems, mid-levels, ancillary providers, all people needed to help in their management, the care, and providing care to their patients and their members too. So I think it's great because, when we look at the revenue kit sharing, you look at how mostly it is on the clinical side, but we should also look at the operational side of that too and make sure that we get some operational efficiency to help those folks provide better care with better quality care. One of the problems that we solve is the actual provider directory quality. And knowing that when you get a doctor that it has a good address, that you can attest to that information and that the quality of information is fresh and up to date. Data quality tends to happen, decay. Data decay occurs at 2% per month. And, at the end of the year, you're 25% down at least on your quality of information if we don't reach out to the physician and ask them to attest the information. So not only do we look at the quality of information, we go out to 50 different sources and bring that in and check against the data itself. We also help with them attest to it, and we help with them clean it up and bit of that up. So that when you go to a doctor, we reduce complaints to the payer, we reduce complaints to the hospital, we help with HEDIS scores getting better. So those efficiencies need to be kind of recognized with this industry.
And fascinating. And without your platform, how is it currently being done? Is it very manual?
Very manual, yeah. What usually happens is you have a utilization manager that's out there trying to check and validate credentialing, trying to check and validate where the doctor is. So one of the biggest problems is the fact that we have NPAS, which is the registering National Registry for Physicians, is self-determinative. So a doctor can go in and change his information any time, and he doesn't have to tell anybody. Or our solution goes out and sees that and says, hey, do you realize this has happened? And here's some recommendations around that. And also, too, if you want to find, like, this is Breast Cancer Awareness Month, right? One of the other aspects that we do is that we're able to take and look at if a payer has an increased enrollment of women over 40. And so what that means is that they're going to have to do breast cancer screening for these women based on COC guidelines and CMS. So what we do is we help them identify where a provider is. And we also can limit it or restrict it to location, not just for oncology. We give you the best oncologist or the required oncologist. You wouldn't have a hematology oncologist for breast cancer. You want a radiation oncologist. So we get the right doctor in the right place and the right location for that particular campaign and need. So you don't have a bunch of utilization managers out there or case managers trying to figure out, where do I get a physician? What do I do with it?
Seems like payers could also benefit from this.
Big time. Payers is really our target audience. Okay. Hospitals, payers, and we also have, we tier our offering based on individual doctors if they want to see what's in their area. Sometimes doctors aren't even communicating with each other because we what specialty codes they have, specialty preferences they have. One of the big specialty preferences coming out, that was the third specialty, is street meds. So street med is one of the big things that we don't have. So now we can get to all those folks and try and figure out, and pediatric street meds to serial-based doctors. So we can help, or we could be an outlet too, but help the right provider in the right place. We can also help with any kind of screenings that people occur with respect to the beams that out. And we don't have to have an orientation in the back of, frankly, looking through a haystack for a needle. And so we get that for them, but our bot does that for you. So if you want,
it's stuff. So fascinating work that you guys do, and yeah, there's nothing more frustrating than showing up as the office is not here.
Yeah, that's one of the biggest problems, right? Just the address alone, the address status does show.
It's happened to me.
As it happened to you? Yeah, and so we
Drive through traffic, and then you're like, "Where's my doctor?"
Oh, I know. It's like being in a GPS and running into a barrier when it says there's a road there. You know, but it's true. You know, one of the problems is that being able to do that. So what we do is we take an attestation document that somebody in the office signed and says, "Oh yeah, that is our address," and they sign it. They send it to us, and then our bot goes out and says, "Ellie, do you want to see if this doctor's attested to the information?" You're going back to the data decay thing, and if they haven't attested in a certain period, guess what? You're at a contract compliance there too, because medical groups have to ensure that they have all their information correct, or they send it to the beta IPAs. So we can help those people too and try to get accurate information, the right doctor, the right place, on time.
That's awesome, Rick. Well, thank you for that. If anybody wants to get in touch with you or learn more about what Ksquare Group does, what's the best place on that?
Well, you go on our website, the Ksquare Group, we're Alex Group, and they have a little click on there. You can just do that. Or you can just write me an email, rick.bemis@ksquaregroup.com. I'm happy to help.
That sounds great, Rick. And folks, we'll leave all of the information on how to get in touch with Rick and the Ksquare Group in the show notes. So make sure you check those out. Take action, because at the end of the day, that's how you improve outcomes for your business and your patients. Rick, thanks for being with us today.
It's all appreciated.
Thank you. And take care. Bye-bye.